Hello, this is Natasha Montgomery. Welcome back to This Therapist Has Problems podcast. Welcome back into my office. How are you doing today? How are you feeling? How was your weekend? How's your week going so far? We're going to do a little vibe check. Drop down in the comments. Just let us know how you're feeling today. If you have not subscribed to this channel, please hit the subscribe button. I have been teetering around close to 500. I think I'm at 490 something subscribers. Please hit the subscribe button. It is free. It doesn't cost you anything, but it does help this channel out a lot. It helps out this space as far as pushing these conversations forward, pushing it to other people who need to hear these type of discussions. So please hit the subscribe button if you have not already. Hit the like button in advance, saying we're gonna like the vibe that we're giving off this episode. Yes, let's jump in. Today we are going to be talking about depression. I mentioned in an episode or two before that I want to be very intentional about explaining different types of disorders, explaining what people may think they look like versus what they actually look like, and helping you to do some guided self-reflection and understanding, are you dealing with any of these things that I'm mentioning? So today our focus, and for this week, our focus is going to be on depression and the different ways that depression shows. Hi, This Therapist Has Problems podcast. So just personal, and this is I'm trying to be transparent, a peek behind the veil of a licensed therapist who is also a human being. So for me personally, I felt like even as a child, I felt like I dealt with some depression. I don't feel like growing up I even knew what the word depression was. I just knew that I had this sense of sadness, this sense of questioning, why am I even here? Why was I even born? This kind of just sadness. And one thing I recognized for me, I am a fall baby. My birthday is in September, and I would always get this deep sadness that would come over me around the time of my birthday. And I didn't really understand why. I think back then when I was growing up, I was like, maybe that means I'm not supposed to be here. I don't understand why I'm always sad around this time of year. As I've gotten older, as I've gotten more education, now I know that seasonal affective disorder is a thing where your mood starts to shift when you come out of those summer months. You're getting closer to the fall, and those are some of those normal cycles that people go through with the changing of the seasons. So one thing that I have become aware of, especially sitting in my seat as a therapist, is that a lot of people, especially in the African American community, struggle with assigning certain diagnoses to themselves, especially when it comes to depression. So I will have clients to say, no, I'm absolutely not depressed. I may feel a little sad, I may be a little down sometimes, but I'm not dealing with depression. But when I help walk them through, this is what depression means. This is what depression looks like. It doesn't always reflect this. I am in the bed, I'm crying all day, I can't function. There is a such thing as functional depression. So we're going to be getting into talking more about what depression actually is and what is most commonly experienced and flies under the radar, which is functional depression. So as always, I have my notes. I'll be looking at my notes to just help us guide through this session. So again, we'll be digging into what depression is. It doesn't always look the same for everyone. So if you're the type of person, you're going to work, you're able to show up for your kids, you're often the person that other people lean on. But inside, there's this deep sense of struggling. You may be dealing with some functional depression. So let's start off with the very basic. What is functional depression? What does it mean? What does it look like? So functional depression isn't a formal diagnosis. I know I mentioned in a couple episodes before, as therapists, we have our diagnosis Bible, which is called the DSM-5, where it breaks down all of the mental health diagnoses, the different criteria that you need to meet to be able to have this clinical diagnosis applied. So in the DSM-5, functional depression isn't a formal diagnosis, but it is a term that we use to describe someone who is experiencing real depressive symptoms but appears to still be managing life on the outside. So, clinically, this often maps to a diagnosis that is in the DSM-5, which is Persistent Depressive Disorder, or PDD. Persistent depressive disorder is a type of long-term, low-grade depression that lasts for at least 2 years. So you may not feel sad every day, but emotionally you feel a sense of heaviness or disconnectedness and this low-grade level of exhaustion almost all the time. So again, persistent depressive disorder is not the same as major depressive disorder, or MDD. MDD has a shortened time frame as far as how long it lasts versus PDD, which is a longer time frame. So it's kind of this low level sense of sadness. You feel like you're in a lull. You feel like I'm always exhausted. I'm never really feeling super motivated about things, but also I'm not crying every day. I'm not in the bed. I'm still able to function. I'm still able to show up in my day-to-day life. Now, where this becomes real as far as in your day-to-day, according to statistics, the National Institute of Mental Health, about 1.5% of adults in the US live with PDD every year. So when you think about 1.5%, that seems like a small number, but think of it in this way. In a room of about 100 people, at least one or maybe two are quietly living with some form of chronic depression. So they're showing up, they're functioning, they may even be able to excel in their career, they're doing great as a mom, but inside they're silently struggling. So as I'm going through these different symptoms, think about yourself. Think about ways that this may apply to you. And again, going back to a previous episode, which I'll link above, is social media is not your therapist, right? So as I'm giving you these things, the only thing is I am prompting you to self-reflect. I am not diagnosing you virtually over this podcast, but the goal is to help you to be reflective and say, do I need to dig a little deeper? Are there some form of help that I need in order to move myself forward? So think about that as I'm going through these different symptoms. So the individual who's showing up, they're functioning, they're doing the best that they can, but they're also silently struggling. These are some ways that the struggle can show up. So again, always being tired, even when you're resting at night, you're getting a full night's sleep. If you get 6, 7, 8 hours, but when you're waking up, you still feel exhausted, right? Feeling numb or disconnected from joy. So even though there's nothing pressing going on in your life that's causing you to feel an immediate sense of sadness, joy also feels out of reach. To say, I just feel meh. I just feel numb. I don't feel like anything is peaking me really high or necessarily peaking me really low. You often may feel like you're going through the motions, but your expression is just flat. It's not too happy. It's not too sad. It's just here. There's no kind of peak of joy, peak of excitement. You're just like, I'm going through the motions, existing day to day, feeling like you're checking the boxes. You may often feel like you're getting praise on how well you're doing while silently asking yourself if you're okay. So other people outside may say, you're excelling, you're doing great, you're a freaking awesome mom, you're getting promotions at your job, you're hitting on those targets for a project, but inside you're like, I don't think I'm doing a good job. I don't think I'm doing well. I think I'm struggling with a lot. So again, these are some things that you may be experiencing if you're dealing with functional depression. The thing about functional depression, right, is you're functioning, right? So because you are functioning, because you're showing up, because you're checking the boxes, other people may say, oh, you're doing great, which leads people not to check in. You're always seen as the strong one. You're always seen as a dependable one. You're always seen as, hey, I can go to you because you're doing well. You have the capacity to show up for me. When inside, carrying a heavy weight, you're carrying a heavy burden that no one on the outside can necessarily see. So think about, are these some things that you're experiencing? Now, when it comes to who is the most affected by functional depression or PDD, persistent depressive disorder, I want you to pause here and I want to speak directly to people who look like me, Black women. This hits us really hard because we are praised for being the strong Black woman. And now I'm like, that is not a compliment, right? That is not something that is it's not a badge of honor to always feel like we have to be strong all the time. We have to push through. We have to persevere. We have to just keep going, even when our world is quite literally on fire around us. So we are often the most affected by functional depression because we are required to show up in our lives. We're required to check all the boxes, to do all the things and be all the things to everyone, which causes us to secretly break down inside, but show up with the face. We got the face on. We look good. We look great. We're doing all the things, but inside we're falling apart. And I can speak from experience and say I have gone through that so often in my life. Even a previous video when I had my crash out files video where it's like I am struggling, but even in the midst of that struggle, I'm still required to show up. I'm still required to show up as a therapist. I'm still required to show up as the helper, as the support, as the mom, as a strong friend. I'm still required to show up and be there for people who may not necessarily know how to be there for me. And because I am functioning, people think I'm doing well when internally my house of cards is falling down. So for you, I think when you think about yourself, especially if you're a Black woman, the ways that you feel like you're forced to show up and be present in your day-to-day life when internally you know that you're not doing okay. So we are often the most affected by functional depression. We are raised in a culture that praises strength. We carry these generational messages about pushing through, staying composed, handling everything and everybody. And while that may have kept us alive, right, thinking about back then and even now, because a lot of the historical things that we've gone through in the past are starting to slowly come back around full circle, right? So even though being strong, persevering, keeping our composure, not being emotional, not being too angry. You don't want to be the mad Black woman, but you also don't want to be the emotional Black woman. Trying to stay as even keel as possible. Those are things that have kept us safe, right, in our day to day, but it doesn't serve us, right? It comes at a cost of our overall mental health. So there is a term in psychology called the strong Black woman schema. And in these studies, like the one published, it's a Journal of Black Psychology, it is shown that this mindset of always being the strong Black woman can often increase our risk for depression and anxiety. So it makes us less likely to seek support because we're told we're supposed to be strong. We're just supposed to deal with it. We're just supposed to persevere and make it through. And because we have this concept that we have to be strong all the time, while internally we're breaking down, it leads us to feel more depression and anxiety, while also preventing us from saying, you know what, do it by myself. I can't figure this out on my own. I do need help to navigate through this. Instead, what we do is, you know what, I'm gonna go get my third master's, or maybe I'm gonna get a PhD, because when we get sad, we get busy doing stuff, right? We find ways to keep our hands busy while mentally and emotionally we're crashing out, we're falling apart. So going to perfectionists, those ones who's like, I got to do everything all the time, I have to do it right, it has to be like da 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 da, I see you, because I have some of those tendencies as well. So you get praise for how productive and reliable you are, but you're burning out in silence. Your inner critic is so loud, which makes rest feel like guilt. You're always feeling like I have to be doing something. I have to be busy. And even when you try to be intentional about giving yourself a break, taking some rest, that inner critic in the back of your head is saying, well, you should have did this, or you got that project, or you could have just did that extra little laundry, or you could have just prepped for the next week, or you have that project you have to do, or you need to go get this for your kids. That inner voice just sometimes won't shut up and allow you to rest. Are you relating? Are you feeling any of these things? Do you feel like something you've been dealing with? You may look fine, but when is the last time someone in your life has truly asked you, are you okay? How are you doing really? How are you feeling? What's going on in your world? Do you need help? Do you need a hug? Do you need someone to listen? But because we're walking around carrying this cape of being the strong woman, your needs, what you're actually needing, often goes unseen and unheard. So we need to be intentional about doing something to change that. What are some signs and symptoms that you personally check in with yourself? I'm very intentional saying you need to check in with you. It's hard to expect other people to know how to help you when you're not even sure how to help yourself. It's hard for people to know what you need when you don't know what you need yourself. So let's talk about some signs and symptoms. Functional depression doesn't always look how we expect. So here are some symptoms I've often seen with my clients, and I've also experienced myself, to be honest. So you feel emotionally flat, numb most days. So again, not too high, you're not feeling joy, you're not feeling excited, but you're also not emotional, crashing, crying out, not being able to get out of the bed. It's just like this apathetic point of view, just flat. Chronic fatigue, so you're feeling super tired. You're having increased irritability or just feeling overwhelmed by the smallest things, right? I'm hearing more and more this term, I'm overstimulated, where the smallest things take you over the edge. Joy feels like a distant concept, even when good things are happening, right? Things can be going on, you can be having a great day, but that joy just feels like it's just out of reach. There's a term called anhedonia, which is just a fancy way of saying you don't enjoy the things that you used to. So if you're feeling like, I used to love going for walks, I used to love cooking or painting or whatever that thing that you used to do, but now it just doesn't bring me joy anymore. I don't feel like doing it. When I think about doing it, I'm just like, I don't really feel like doing that, right? You feel like nothing is really causing you to feel fulfilled or happy. Another symptom is you may have trouble focusing, staying motivated, or the ability to finish tasks that you start. So you're always halfway doing things, right? You're always halfway showing up, halfway paying attention. I know now we live in this age where we're always distracted. So you can intentionally sit down, put on a movie, you say, I'm going to relax, I'm going to chill, I'm going to watch a movie. But while that movie's on, you're scrolling. Right? You're never really truly focused on one thing at a time. Another symptom that you may recognize, that you talk in ways that you would never speak to anyone else. So again, that inner critic, she can be a pain. The harshest, meanest things you say to yourself in your head that you quite literally may not even say to your worst enemy. Oh, you're lazy. Oh, you can't get that done. You're worthless. Oh, you're a waste of time. You're a waste of energy. Oh, you're not accomplishing anything. You're a failure. Oh, you suck at this. You suck at that. Those things, those seeds got to get planted in our head by our inner critic that tears us down. You find when you're dealing with functional depression, that voice gets louder and louder. So if you identify with any of these symptoms that I've listed, or you say, these are some things that I've been dealing with and I couldn't quite put a label on it, you may be dealing with some functional depression. So according to, again, the DSM-5, which is our diagnostic manual, someone who has PDD, Persistent Depressive Disorder, needs to have low-level moods for most days, which is more days than not. So say, for instance, it's just throwing that out there, 5 days out of 7 days a week, you're feeling like you're in a low mood for at least 2 years. On top of that, you also need to have at least one of 2 other symptoms, like a poor appetite, low self-esteem, hopelessness, or sleep issues. So this is getting into what is the criteria for diagnosis. So again, you having a low mood for more days than not for at least 2 years, as well as having other symptoms present, such as a change in your appetite, low self-esteem, feeling hopeless, or experiencing some sleep issues. So if you're identifying with this, do some additional research to say, if I am dealing with this issue, what are next steps? Is it talking to a therapist? Is it talking to your primary care doctor? Is it talking to a psychiatrist? I'm giving you this information for self-reflection, but it's up to you to take this and determine what is the next steps. Are you choosing to continue to exist in a state of functional or persistent depression, or can you be aware of this and do something to change it? So, why does functional depression often fly under the radar? Why do people often miss this? Why do people fail to notice this? And it's because we've been taught that depression has a very specific look to it. We've been taught that depression looks like crying, isolating, staying in bed all day. But depression isn't always loud. It doesn't always scream. Sometimes it whispers and flies under the radar. There was a study in 2017, the Journal of Affective Disorders, that found that people with high functioning depression often internalize their distress. That means they can still be productive, they can still be social, but deep down they're carrying a heavy emotional pain. So it makes sense why functional depression flies under the radar, because outside looking in, everything appears to be in order. You appear to be doing well, you're functioning, you're thriving, right? As far as other people can see, but because when you're dealing with functional depression, you internalize it, other people can't see what you're actually feeling inside. So you might be the person that everyone depends on, right? You may be a therapist listening to this podcast. You're a teacher, a nurse, a doctor, a mom, a high-ranking position at your job, right? You may be just the person in your family, your social circle that everyone depends on. Just because you're functioning, no one thinks to ask if you're okay. So it becomes your responsibility to let people know, hey, I'm struggling. Hey, I don't have the capacity. Hey, I am the one who needs support. I know you're used to coming to me for everything, but for right now, I am the one who needs support. It may not look like I'm struggling, but I am. One thing to keep in your mind, just because you're being productive doesn't mean that you're well. Performing isn't a state of healing. Just because you're performing doesn't mean that everything is okay. You've just been taught to function regardless of what you're feeling inside. Path to healing. This is the part that gives me some hope because, again, I myself have dealt with functional depression. And it's important to recognize you don't have to live like this. Healing is possible. Healing is an option, and it starts with naming what is happening inside of you. Starts with, one, again, checking in with yourself, going through these different symptoms that I've listed and say, okay, you're experiencing these things, name it, talk about it, be clear with yourself to say, okay, maybe something that I'm struggling with. Recommendations for healing or creating a path for healing. I am a therapist who believes fully in therapy. I am a therapist who has a therapist. Therapy is such a great outlet, a great tool, especially if you feel like I can't necessarily talk to the people around me. They won't understand. They expect me to be strong. They expect for me to have it all together. Choose to go to therapy. Give yourself that unbiased space to be honest, to seek help, and to seek clarity on how to move forward in your life in a healthier way. In therapy, there is a therapeutic technique called cognitive behavioral therapy, or CBT. The whole basis of cognitive behavioral therapy, so cognitive thoughts, behavioral therapy helps you to change your negative thinking patterns. And because you're changing your thinking patterns, your behavior will follow. So that is a great technique when you're looking for a therapist who specializes in CBT. Another therapy that I love is emotionally focused therapy, which helps you to connect your emotions and help you build healthier relationships with others and with yourself. So again, if you become more knowledgeable about your emotions, then you can become more aware of how your emotions affect your thinking patterns and your behavior. And when you have a better understanding of that, you recognize that you can make better and healthier choices for yourself. Outside of therapy, and often in conjunction with therapy, is medication management. So there are very common antidepressants that help you balance out your brain chemistry and help you be able to manage your mood and really recognize, okay, there's a chemical imbalance present that is causing this persistent depression or this functional depression. Medication is an option, and for a lot of people, you see significant changes in their mood once they've committed to saying, you know what, if my body chemistry is off, it's okay to take medication. I think we have so stigmatized mental health that we don't consider the medical components attached to our mental health to say, if you were dealing with any other health disorder, medication is often recommended, and oftentimes we don't think twice when our doctor recommends medication. When it comes to your mental health, medication is something that is necessary or that can give you that boost to help you get out of that lull of just being depressed. Use it as a tool while you're gaining other tools through therapy to help you get to a better place. Another technique or method in helping you heal is rest and recovery. And I'm not just talking about physical rest, not just sleep. I'm talking about emotional rest. Taking time away from being the dumping ground for other people, really assessing, do I have the capacity to show up for other people? Or do I have the capacity really right now only to show up for myself? Giving yourself space to take an emotional hiatus, to take a break, to really pour in, nurture yourself, and guide yourself towards healing along with these other tools of therapy and medication. The next one is community. So therapy is amazing. Like I said, I'm a strong believer in therapy, but so is having healthy, safe people in your life. So having friends, having support groups, having spaces that let you be your honest and authentic self. So creating that if you don't have it, leaning on people in your life if you do, but saying, I need support, I need help, I need to also be the one leaning and not just everyone leaning on me. So utilizing your community as well. And then the last one I'll give you a little tip is having both compassion and boundaries. So allowing yourself to say no to things that drain your energy and saying yes to things that feed you. So start speaking to yourself in ways that you would speak to other people that you love. That's one way, right? To have compassion towards yourself, to say, would you be saying that to your child? Would you be saying that to your parent or your friend? Would you talk to yourself in this way if you considered yourself to be your friend? If you consider yourself to be a loved one? Checking yourself, right? Taking a pause as you hear that negative inner critic speak, saying, no, I'm not listening to that. These are the positive words that I choose to say to myself instead. I am a huge proponent of positive affirmation. So being intentional about being compassionate towards yourself and setting boundaries with yourself. So we often put boundaries external, but sometimes we need some internal boundaries of checking ourselves and saying, no, I'm not talking to myself that way. I'm not believing these things. And I always say, just because you think something doesn't mean it's true. Your brain will throw such negative things at you, but you have to challenge that. So again, what are some ways that you can heal from functional depression? Therapy, medication, true emotional rest and recovery, leaning on your community, and having compassion and boundaries towards yourself. So again, assessing your capacity to be there for others, assessing your capacity to show up in the same spaces in the same ways, and setting boundaries for other people while you're also setting boundaries for yourself. If there is anything that resonated with you from what I've shared today, again, this is a space of honesty, vulnerability, and self-reflection. So take a moment to truly assess anything that I've shared with you today. If you feel like you relate to potentially having some functional depression, I am imploring you, please give yourself the opportunity to experience what peace and joy looks like. Get the help that you need in order to say you don't have to be the strong one all the time. It's not realistic. Even God himself took a break and got some rest. Even God himself allowed himself to weep, right? Understanding we are not superhuman. We were created to be human for a reason, and all of our emotions matter. Give yourself space to assess where you are, seek help when needed, and challenge yourself to say, I don't want to live like this anymore. I don't have to live like this anymore. So even me as a therapist, go back and look at my crash out video, right? When I am feeling these bouts of depression, when I'm going through things that are triggering the depression or just kind of through those seasonal changes of my hormones and emotions, I allow myself to feel my feelings. I give myself time to be honest and truly assess where I am emotionally, but also I don't let myself stay stuck there forever. I reach out for support. I go to my therapist. I talk to my core support system. I allow myself to truly get the support that I need so that I can choose actively what I want my life to look like and not allow my life to be a bystander of what my emotions are telling me. So again, if this resonated with you, one thing to recognize is you're not broken, you're not weak. You don't need to wait until you hit rock bottom, that you collapse, that you're just like, okay, I am in deep, serious depression in order to get support. Take stock of where you are now and act on it. Maybe you're functioning, but you're fading. It's time to stop surviving and start tending to your emotional well-being. Thank you for listening to this podcast. Thank you for stepping into my office. I hope that you have learned something today. I hope that not only this resonates with you, but also if you feel like there's people around you, right, who they seem not as happy as they should be, even though they are thriving and functioning and checking all the boxes. Check in with them and saying, no, how are you actually doing? How are you feeling? We need to be more intentional about checking in with each other, but we have to start with checking in with ourselves. Again, if you are located in the state of Texas and you're looking for a therapist, my contact information is on this video if you would like to reach out and schedule an appointment. If you're needing support and you're outside of the state of Texas, I always recommend Psychology Today, Open Path. Those are good resources for therapists. If you have insurance, always recommend reaching out to your insurance company to determine if you have any free EAP sessions available, and find support. Lean on your support. We are created for community. So understanding that as much as other people depend on you, you can reach back and depend on them as well. If you have not already, I will reiterate, hit the subscribe button, subscribe to the channel so you are aware. Hit the notification bell because I found that people who are subscribed are often not notified when I post new videos. So if you're subscribed, hit the notification bell so you're aware of when I'm posting the next podcast episode. Subscribe, hit the like button on this video. And I will like to challenge you, as you're watching this video, what is one thing that may have resonated with you that I shared with this video, if you feel comfortable? And what is one thing that you're choosing to do in order to get the support that you need if this video did resonate with you? Thank you again for stepping into this office. Thank you so much for watching this podcast. Again, I created a whole practice, M.B.S, about taking care of your mind, your body, and your spirit. Check in with yourself, assess how you're doing mentally, physically, emotionally, and let's help each other navigate to becoming healthier, whole people. I love you. I hope you're doing well, and I will see you next time. Bye.